The stroke warning sign that appears while you sleep. Most seniors miss it. What if one of the most dangerous warning signs of a stroke appeared while you were sleeping? What if your body was trying to warn you that something was wrong, but the signal came in the middle of the night when most people would never think twice about it? Every year, hundreds of thousands of Americans suffer a stroke, and many are shocked to learn that their bodies may have been sending warning signs beforehand. The problem is that these symptoms are often subtle, temporary, and easy to dismiss. Most people assume they're just part of getting older. They blame stress, poor sleep, fatigue, or sleeping in an awkward position. But what if those nighttime symptoms were actually your brain asking for help? Before we begin, let us know your age and where you're watching from in the comments below. And if you have a parent, spouse, sibling, or friend over the age of 60, consider sharing this video with them, because the information we're about to discuss could make a life-changing difference. Imagine this scenario. A 72-year-old retired teacher goes to bed feeling perfectly fine. She enjoys dinner with her family, watches her favorite television show, and falls asleep shortly before 10 p.m. Everything seems normal. Then, sometime around 3 a.m., she suddenly wakes up. At first, she doesn't know why. Something just feels different. Her left arm feels unusually heavy. She tries moving it and notices it doesn't respond quite the way she expects. Then she whispers a few words to herself and realizes her speech sounds slightly slurred. The symptoms last only a few minutes before fading away. She convinces herself she slept on her arm the wrong way and goes back to sleep. 2 days later, she suffers a major stroke. Doctors later explain that what she experienced may have been a transient ischemic attack, often called a mini-stroke, which can serve as a warning sign before a larger stroke occurs. Stories like this are more common than many people realize. One of the most important nighttime warning signs of a stroke is waking up with sudden weakness or numbness on one side of the body. This symptom can affect the face, arm, hand, leg, or even an entire side of the body. Many people immediately assume they've slept in an awkward position. After all, most of us have experienced a numb arm after lying on it too long. But stroke-related weakness often feels different. Instead of simple tingling, there may be a genuine loss of strength. The arm may feel heavy, the hand may struggle to grip objects, the leg may feel unstable. Some people even notice that one side of their face feels unusual when they smile or speak. The frightening part is that these symptoms can disappear quickly. A temporary blockage of blood flow to the brain can cause symptoms that last only minutes before resolving. Unfortunately, many people interpret this as proof that nothing serious happened, when in reality it may be one of the most important warning signs they could ever receive. Another symptom that frequently appears during the night is difficulty speaking. Imagine waking up and trying to say something, only to discover that your words sound strange. Maybe your speech is slurred. Maybe you know what you want to say, but can't seem to form the words correctly. Some individuals report feeling confused or unable to understand simple language. Because these symptoms occur during the middle of the night, people often blame grogginess or fatigue. They assume their brain hasn't fully woken up yet. However, sudden speech problems are among the most recognized warning signs of a stroke. The parts of the brain responsible for language are extremely sensitive to interruptions in blood flow. Even a brief disruption can create noticeable changes. If speech suddenly becomes difficult, even for a few minutes, it should never be ignored. Vision changes are another warning sign that many seniors overlook. Some people wake up and notice that one eye seems blurry. Others experience double vision. Some describe it as a curtain or shadow moving across part of their field of view. Because these symptoms often improve, they're frequently dismissed as dry eyes, fatigue, or poor lighting. Yet the brain is responsible for processing visual information, and when blood flow becomes compromised, vision can be affected. In some cases, vision changes may be one of the earliest signs that a stroke is developing. Another symptom that deserves attention is dizziness. Most people experience occasional dizziness from time to time. Standing up too quickly, dehydration, or certain medications can all cause brief episodes. Stroke-related dizziness is often different. Some individuals describe feeling as though the room is spinning. Others experience a sudden loss of balance or coordination. They may struggle to walk in a straight line or feel unsteady when standing. These symptoms can appear suddenly and without warning. Because dizziness has many possible causes, people often underestimate its significance. However, when dizziness occurs alongside weakness, numbness, speech problems, or vision changes, it becomes much more concerning. Now let's discuss one of the most overlooked warning signs of all. Many stroke survivors later report waking up during the night with an unexplained feeling that something wasn't right. They couldn't describe it exactly. There was no severe pain. There was no dramatic symptom. There was simply a sudden sense of confusion, discomfort, anxiety, or mental fog. They felt different, even if they couldn't explain why. Because the brain controls nearly every function in the body, interruptions in blood flow don't always produce obvious symptoms. Sometimes the warning signs are subtle. Sometimes they appear as changes in awareness, thinking, or mental clarity. These symptoms are easy to dismiss because they're difficult to describe, but they can be important clues that something is wrong. One reason nighttime stroke symptoms are so dangerous is that many people simply go back to sleep. Imagine waking up with mild numbness, slight dizziness, or brief speech difficulty. The symptoms improve after a few minutes. You assume everything is fine and return to bed. Unfortunately, a transient ischemic attack can occur hours, days, or even weeks before a major stroke. Medical experts often describe a mini-stroke as the body's emergency warning system. It's a chance to recognize a problem before permanent damage occurs. Ignoring that warning may allow a much larger event to develop later. Understanding stroke risk factors is also important. Age remains one of the biggest risk factors. As we grow older, blood vessels naturally become less flexible and more vulnerable to damage. High blood pressure is another major contributor. In fact, many experts consider uncontrolled blood pressure to be the leading risk factor for stroke. Diabetes, high cholesterol, smoking, obesity, lack of physical activity, and certain heart rhythm disorders can also increase risk. One heart condition known as atrial fibrillation deserves special attention because it can allow blood clots to form within the heart. If one of those clots travels to the brain, it can block blood flow and trigger a stroke. The good news is that many risk factors can be managed. Regular physical activity, healthy eating habits, controlling blood pressure, managing blood sugar, avoiding tobacco products, and attending routine medical appointments can all help reduce risk. Sleep health is also important. Conditions such as sleep apnea, which causes repeated interruptions in breathing during sleep, have been linked to an increased risk of both stroke and heart disease. People who snore heavily, wake up gasping for air, or feel exhausted despite a full night's sleep may benefit from discussing these symptoms with a healthcare professional. At this point, it's important to remember a simple acronym used by health organizations across America: FAST. F stands for face drooping. Ask the person to smile. Does one side of the face droop? A stands for arm weakness. Can both arms be raised equally? S stands for speech difficulty. Is speech slurred or unusual? T stands for time to call emergency services. If any of these signs are present, immediate action is critical. Every minute matters, because brain cells can begin dying when blood flow is interrupted. The sooner treatment begins, the greater the chance of preserving brain function and reducing long-term disability. As we close today's video, remember this important message. The most dangerous thing about stroke warning signs is not that they're severe. It's that they're often easy to ignore. A little weakness, a few minutes of dizziness, slightly blurred vision, brief speech problems, mild confusion in the middle of the night. These symptoms may seem insignificant, but they could be your body's way of warning you that something serious is developing. Your body often whispers before it screams. The key is learning to listen. If you ever experience sudden weakness, numbness, speech difficulty, vision changes, dizziness, confusion, or any other symptom that feels unusual, seek medical attention immediately. Acting quickly could protect your independence, your quality of life, and potentially your life itself. If you found this information helpful, please like this video, subscribe to the channel, and share it with someone you care about. You never know whose life could be changed by recognizing a warning sign before it's too late. Stay healthy, stay informed, and thank you for watching.